Okay.
Start. Okay, so here we have a representative of a mammalian heart. This heart is that of a sheep. All mammal hearts look exactly alike. The only difference would be the weight, the size and the weight of the heart. A pygmy shrew, which is the smallest known mammal, has a heart that weighs about 0.1 grams. And an African bull elephant has a heart that weighs about 45 kilograms. So there's a massive difference in the size and weights of the heart. However, the anatomy of the hearts are all the same. Okay, so if we look at some of the external anatomy, here we have the left ventricle, which we'll see when we cut open is the largest ventricle and has the thickest part of the heart. Up here, we have the right ventricle, okay? So this is the interventricular sulcus, which divides the left and right ventricles. On the top here, we have the atria, and these little parts that stick out from the top, you can see one over here, and you can see one here, okay? These are the right and left auricles. The auricles are on top of the atria, and they increase the surface area. As you're probably aware, the atria, where blood comes into, is significantly smaller than the ventricles. So in order to accommodate all of the blood, these little auricles, sometimes called the dog ears, will expand to accommodate that blood. Here we have, this is the left descending coronary artery, okay? This is also known as the widowmaker. People who have a blockage in that artery often don't survive their heart attack. If we look to the top, we have the inferior vena cava, okay? The inferior vena cava brings deoxygenated blood from the body. Excuse me, this is the superior vena cava. The superior vena cava brings deoxygenated blood from the body into the right atria. Over here, we have the aorta. The aorta is now going to bring oxygenated blood that's pumped out of the left ventricle into the entire body, into the systemic circulation. On this side, we have the pulmonary branch of the pulmonary arteries. So this is going to bring deoxygenated blood from the right ventricle to the lungs. Normally, arteries carry oxygenated blood. The pulmonary artery is the only artery that carries deoxygenated blood. And this is the pulmonary vein. The pulmonary vein is going to carry oxygenated blood back from the lungs to the heart. Typically, veins carry deoxygenated blood. The pulmonary vein is the only vein that carries oxygenated blood. Okay, so now we're going to slice the heart in half. We're going to cut it down the long axis, sort of like a book. Okay, so give me a second here. Make sure I don't cut my videographer with the knife. Okay, so this is like a book. So we've cut it, and it's a mirror image on both sides. So here, probe. Here we have the left ventricle. So the left ventricle contains the thickest part of the heart, the myometrium, the thickest part of the muscle of the heart, here and here, okay, which corresponds on this side to here and here. This over here is the right ventricle of the heart, okay. If you look at these little muscles here, these are called the chordae tendineae, sometimes known as the heartstrings. There's an American expression about pulling on someone's heartstrings, or there's a line in a Van Morrison song, say they're playing the heartstrings soft and low. When the papillary muscles, which are these thick muscles down here, right here, these muscles here, contract, they pull the chordae tendineae together. There's chordae tendineae on both sides, and that's what opens and closes the valves of the heart, okay? So here we have up here, let me see, let me get this. Okay, so coming out of the left ventricle, we said that we have the aorta. So this is pumping the blood to the body. Okay. In the right, so let me close this, orientate this again. Left ventricle, right. Okay. So up in here, which would be on this side, this is the right atria. And in the right atria, this little bump here we see, this is the sinoatrial node. Remember we said that in the slides that the sinoatrial node starts the process of the cardiac conduction system. So this is the pacemaker of the heart. So this will travel across both sides to both atria, causing them to contract simultaneously. Also, on the outside, we should mention that we said that we have, put it this way, that we have the aorta. Here's the vena cava, okay? And here is the aorta, okay? This little piece of tissue right here, is what's known as the ligamentum arteriosum, okay? The ligamentum arteriosum is the remnant of the ductus arteriosus. The ductus arteriosus connects the aorta with the pulmonary trunk in developing babies, in fetuses. This way the blood bypasses their lungs, because if they were breathing in while they're inside the uterus, they'd simply be breathing in amniotic fluid. So there's no breathing in the fetus. However, after they're born, this closes off and these two vessels become separate from each other. Remember, on the right side of the heart, we have the tricuspid valve. The tricuspid valve, which is pulled open and closed by the chordae tendineae, have 3 parts to it. And on the left side of the heart, we have the bicuspid valve, also known as the mitral valve, which has 2 flaps. So when we look inside the heart, as we said earlier, there's not a lot of things to see. The heart, for all that it does, and it needs to beat from about 6 weeks after conception until the moment you die, is very, very simplistic organ. It's probably very difficult to operate on, but structurally it's quite simple. So I hope that gives you some appreciation of the basic structures of the mammalian heart. Thank you.